Earlier this year, and until the 12th of March, the government's own official advice was, and I'm quoting from it, "It remains very unlikely that people receiving care in a care home will become infected." Yesterday's ONS figures showed that at least 40% of all deaths from COVID-19 were in care homes. Does the Prime Minister accept that the government was too slow to protect people in care homes?
Prime Minister.
No, Mr. Speaker, it wasn't true that the advice said that, and actually we brought the lockdown in care homes ahead of the general lockdown, and what we've seen is a concerted action plan to tackle what has unquestionably been an appalling epidemic in care homes, and a huge exercise in testing is going on. A further £600 million I can announce today for infection control in care homes. And yes, it is absolutely true that the number of casualties has been too high, but I can tell the House, as I told the Honourable Gentleman, Right Honourable Gentleman, last week and indeed this week, the number of outbreaks is down and the number of fatalities in care homes is now well down. There is much more to do, but we are making progress, Mr. Speaker.
For many weeks, the government has compared the UK number against other countries. Last week, I showed the Prime Minister his own slide, showing that the UK now has the highest death total in Europe and second highest in the world. A version of this slide has been shown at the number 10 press conference every day since the 30th of March. That's 7 weeks. Yesterday, the government stopped publishing the international comparison and the slide is gone. Why?
Minister.
Mr. Speaker, as he knows very well, the UK has been going through an unprecedented, once-in-a-century epidemic, and he seeks to make comparisons with other countries which I'm advised are premature, because the correct and final way of making these comparisons will be when we have all the excess death totals for all the relevant countries. We do not yet have that data. Now, Mr. Speaker, I'm not going to try to pretend to the House that the figures, when they are finally confirmed, are anything other than stark and deeply, deeply horrifying. This has been an appalling epidemic.
The Prime Minister says his decisions were, and I quote, "driven by the science, the data and public health." So to give the public confidence in the decisions, can the Prime Minister commit to publishing the scientific advice that the decisions were based on?
Prime Minister.
Mr. Speaker, all sage advice is published in due course, as the Right Honourable Gentleman knows. I think people can see exactly what we're trying to do as a country, and they can see that everybody is still required to obey the social distancing laws, the social distancing rules. And the common sense of the British people got us through that first phase of this disease. I'm absolutely confident they will get us through the next as well.